Understanding a nervous breakdown. Causes, symptoms, and coping strategies. A nervous breakdown, also known as a mental or emotional breakdown, is a term used to describe a period of intense mental distress. During this time, a person is unable to function normally in day-to-day life due to overwhelming stress or anxiety. While nervous breakdown is not a clinical term, it is often used to describe a range of mental health issues, such as severe anxiety, depression, or acute stress. This video drills into the causes, symptoms, and coping strategies for dealing with a nervous breakdown. What is a nervous breakdown? A nervous breakdown is a state of acute psychological distress that leaves a person feeling emotionally and physically incapacitated. It often occurs when someone is unable to cope with prolonged stress, resulting in a sudden or gradual mental collapse. This condition can affect anyone, regardless of age, gender, or background, and is often triggered by significant life events, such as job loss, relationship problems, financial difficulties, or the death of a loved one. Though the term nervous breakdown is commonly used, it's important to note that it is not a specific mental health diagnosis. Instead, it serves as a general term for a range of mental health crises, including severe anxiety, panic attacks, depression, and acute stress disorder. Understanding the underlying causes and symptoms can help in recognizing and addressing the condition effectively. Causes of a nervous breakdown. A nervous breakdown can be triggered by various factors, often related to overwhelming stress. Some common causes include chronic stress. Prolonged exposure to stress, whether from work, relationships, or financial pressures, can deplete the body and mind's ability to cope, leading to a breakdown. Trauma. Experiencing a traumatic event, such as the loss of a loved one, abuse, or a serious accident, can trigger a breakdown. Mental health disorders. Pre-existing mental health conditions such as anxiety, depression, or bipolar disorder can contribute to the likelihood of a breakdown, especially if left untreated. Life transitions. Significant life changes such as moving, starting a new job, getting divorced, or retiring can cause emotional turmoil and stress, potentially leading to a breakdown. Substance abuse. The use of alcohol or drugs to cope with stress can exacerbate mental health issues, increasing the risk of a breakdown. Sleep deprivation. Chronic lack of sleep can impair cognitive function and emotional regulation, making it difficult to manage stress effectively. Lack of support. Feeling isolated or lacking a support system can make it harder to cope with stress, increasing the risk of a breakdown. Symptoms of a nervous breakdown. The symptoms of a nervous breakdown can vary widely from person to person, but they generally involve a combination of emotional, physical, and behavioral changes. Common symptoms include emotional symptoms. Overwhelming anxiety, persistent and intense feelings of fear or worry that interfere with daily life. Depression, feelings of hopelessness, sadness, and despair, often accompanied by a loss of interest in activities that were once enjoyable. Irritability, heightened sensitivity and a tendency to become easily frustrated or angry. Panic attacks, sudden episodes of intense fear or discomfort, often accompanied by physical symptoms such as chest pain, shortness of breath, and dizziness. Emotional numbness, a sense of detachment or feeling disconnected from one's emotions or surroundings. Physical symptoms, fatigue, persistent exhaustion, and lack of energy even after resting. Sleep disturbances, difficulty falling asleep, staying asleep, or sleeping excessively. Changes in appetite, loss of appetite or overeating, often leading to weight loss or gain. Headaches, frequent or severe headaches, often linked to stress or tension. Gastrointestinal issues, stomach aches, nausea, diarrhea, or other digestive problems. Muscle tension, tightness or pain in the muscles, particularly in the neck, shoulders, and back. Behavioral symptoms, social withdrawal, avoiding friends, family, and social activities that were once enjoyable. Difficulty concentrating, trouble focusing on tasks, making decisions, or remembering things. Neglecting responsibilities, difficulty managing daily responsibilities, such as work, household chores, or personal hygiene. Increased use of substances, turning to alcohol, drugs, or other substances to cope with emotional distress. Coping strategies and treatment options. If you or someone you know is experiencing a nervous breakdown, it's important to seek help and take steps to manage the situation. Here are some coping strategies and treatment options that can help. Seek professional help. Therapy. Talking to a mental health professional, such as a psychologist or therapist, can provide valuable support and guidance. Cognitive behavioral therapy, CBT, and other therapeutic approaches can help address the underlying causes of stress and develop coping mechanisms. Medication. In some cases, medication may be prescribed to help manage symptoms of anxiety, depression, or other mental health conditions. Antidepressants, anti-anxiety medications, and mood stabilizers can be effective in stabilizing emotions and reducing distress. Prioritize self-care. Rest. Ensure you are getting enough sleep each night. Sleep is crucial for emotional regulation and cognitive function. Nutrition. Eat a balanced diet rich in nutrients that support mental and physical health. Avoid excessive caffeine, sugar, and processed foods. Exercise. Engage in regular physical activity such as walking, yoga, or swimming. Exercise releases endorphins, which can improve mood and reduce stress. Practice stress reduction techniques. Mindfulness meditation. Mindfulness practices can help you stay present and manage stress more effectively. Techniques such as deep breathing, progressive muscle relaxation, and guided imagery can reduce anxiety and promote relaxation. Time management. Break tasks into smaller, manageable steps to avoid feeling overwhelmed. Prioritize tasks and delegate when possible. Limit stressors. Identify and minimize sources of stress in your life, whether it's work-related, financial, or personal. Build a support system. Reach out. Don't be afraid to ask for help from friends, family, or support groups. Sharing your experiences and emotions with others can provide relief and perspective. Social connections. Stay connected with loved ones and participate in social activities that bring you joy. Positive social interactions can improve mood and reduce feelings of isolation. Create healthy boundaries. Say no. Learn to set limits and say no when necessary. Overcommitting yourself can lead to burnout and increased stress. Work-life balance. Ensure a healthy balance between work and personal life. Take time to relax and engage in activities that recharge you. Focus on the present. Stay grounded. When feeling overwhelmed, focus on the present moment rather than worrying about the past or future. Grounding exercises, such as focusing on your breath or the sensations in your body, can help keep you centered. Plan for the future. Set goals. Set realistic and achievable goals for your recovery and personal growth. Having a plan can provide a sense of direction and purpose. A nervous breakdown is a serious mental health crisis that can have profound effects on a person's emotional, physical, and social well-being. Understanding the causes and symptoms of a nervous breakdown is crucial for recognizing when to seek help. With the right support, coping strategies, and treatment, it is possible to recover from a nervous breakdown and regain a sense of balance and well-being. Remember that you don't have to go through it alone. Reaching out for help is the first step towards healing. If you received value from this video, please like, subscribe, and comment.